Like and subscribe and click the bell icon to get new video updates.
Some top scientists are concerned use of the word endemic with connection to COVID-19 is missing the mark. Coronavirus restrictions are disappearing by the week in much of the world, as more Western countries scale back their remaining restrictions and inch toward a policy of living with COVID-19. The more transmissible but less severe Omicron variant, and its subvariant, BA.2, have played a large role in that calculation, convincing many leaders that endemic COVID-19 is in sight. But what does that mean? Some top scientists are concerned that our understanding of endemic is wide of the mark. I think we've done a huge disservice using the word endemic. Frankly, Michael Fraser, executive director of the U.S. Association of State and Territorial Health Officials, told an audience of mostly public health officers during a panel discussion at the 2022 Preparedness Summit in Atlanta today. There are endemic diseases that kill 400,000 people a year, like malaria. And there are endemic diseases like herpes or HSV1 that are in half the population, and maybe you get a cold sore. Endemic refers to the constant presence or usual prevalence of a disease or infectious agent among a population within a geographic area, according to the U.S. Centers for Disease Control and Prevention. It doesn't seem to fit. Lori Tremmel Freeman, Chief Executive Officer of the National Association of County and City Health Officials, told CNN at the event. It seems like a false narrative to talk about the end. We can plan for it, but we have to be ready to go back to measures if we see another variant or another wave. It is a pressing discussion, given that the Western world is moving, albeit at different speeds, toward a pre-pandemic set of measures and rules. European countries brutally ended their restrictions in the early part of this year, the World Health Organization said, and April has seen Germany scale back mask rules and the UK scrap all of its prevention measures. The US, meanwhile, could let its mask mandate in airports and on flights lapse on Monday. Instead of using endemic, Mr Fraser said, public health leaders should focus on what sustained management of COVID-19 might look like. That means exploring options like annual booster shots, keeping some prevention measures in reserve for future outbreaks, and constant monitoring of where, when and how the virus is spreading. We tend to think of endemic as really just an expected disease that is out there circulating, Janet Hamilton, Executive Director of the Council of State and Territorial Epidemiologists, said during the panel. That is definitely what COVID is going to be, but the expected part is still, I think, such a big question on the table, she said.